To access it, we just head over to retorio.com and create an account. After accessing the admin environment of Retorio, we brief the AI coach what we want to get out of our coaching program. Basically, we just put our goals in the generator and the AI coach understands what we're trying to accomplish. So let's assume during the launch of Smolder Light, we want to differentiate it from other products on the market. For instance, we want our sales reps to ask oncologists about their preferred treatments. And in a second stage, we want them to present clinical evidence highlighting the effectiveness of the drug and highlight how Smolder Light results, for instance, in fewer adverse effects. Or maybe in a third stage, we want them to discuss a concrete case of a patient who could benefit from the treatment. Then we have various options to enrich our coaching program. We can, for instance, copy and paste our product sheets, clinical studies, or information about our company or competitor. We can also fine-tune our instructions by adding specific MLR-approved talking points from clinical studies. So our field team always knows exactly what to reference. Please note that we don't need to come up with all of these instructions from scratch. The AI session generator writes most of it for us, but we always stay in full control. For example, in this case, we want the sales rep to mention the results of a phase 3 trial. To stay compliant and free from hallucinations, we simply link the original study or source documents supporting this claim. The AI coach would then use this reference during the simulation, guiding the rep back to the verified material. In the next step, we create digital twins of doctors, virtual counterparts that engage with your field force just like real healthcare professionals would. In our demo case, we're focusing on oncology. Some of them might be key opinion leaders, quick to adopt new treatments as soon as they're reimbursed by health insurances. Others could be comfort-driven or late adopters who need additional evidence or persuasion. With Retorio's coaching generator, we can easily build these diverse personas based on our own HCP segmentation. And the AI would bring them to life in a realistic, interactive simulation. Here we are designing an oncologist called Dr. Harbour. She's going to be female and a key opinion leader oncologist. Let's give her a neutral attitude to our product, an intellectually curious personality, and a priority for wisdom. We give her a female appearance and pick a matching voice. This is actually quite a lot of fun. Dr. Harbour has her own needs, challenges, and goals, which we can define right here. She's looking for robust, peer-reviewed clinical data on Smolder Light's efficacy across specific cancer subtypes and pain intensity level. Let's say her goal is to optimize the patient's quality of life, but she's also concerned about data maturity and long-term evidence. In principle, you could import your entire HCP segmentations into these fields, and the digital doctors will behave exactly according to the profiles you define. You can build a whole library of virtual HCPs and reuse them for each coaching program you build. After saving my training program, I can just duplicate it and let the AI automatically translate it in up to 14 different languages. Some of our clients use it globally, and this feature enables them to launch coaching sessions around the world 10 times faster than before. In the next step, we invite our field force to engage in conversations with our virtual doctor. They may receive an email invitation, or we can also trigger simulated conversations through the CRM system. For instance, in preparation for a real meeting with the HCP in the same customer segment.
The doctor is ready to see you now.
As a sales rep or MSL, I can instantly access the coaching program we've just created, and I can choose with which HCP persona I want to prepare myself today for the upcoming launch. There's a quick tech check, some simple instructions, and the conversation begins. You see, at the start of the conversation, my goal is to build rapport and get to know the healthcare professional better. Whenever I achieve a key training objective, the AI coach jumps in with instant feedback and guides me smoothly into the next stage of the conversation. And the best part, the dialogue is completely dynamic. The virtual doctor responds just like a real one would, with all the boundaries we've just set for this specific scenario. After I connected with the doctor and qualified her pains and needs, I will try to position myself as a trusted advisor who has the required clinical knowledge. Let's listen in for a bit.
I'm familiar with BioGemini. I've seen some of your research, particularly around novel oncology treatments. before we dive into that, I just want to learn a little bit more about your currently preferred treatment options for cancer-related pain.
Of course, my primary goal is always to optimize my patients' quality of life, which often means effectively managing their pain. I've seen some of the early phase data, mostly abstracts from conferences. Unfortunately, I was unable to attend ESMO this year due to clinical commitments. So no, I did not attend that panel.
What the trial finds is that we have 48% faster onset of analgesia compared to morphine sulfate.
Those are indeed significant findings. A faster onset of analgesia and a reduction in breakthrough pain are clinically meaningful, especially for advanced stage cancer patients.
Well, I guess I'm not quite there yet. At the end of the conversation, the guided AI feedback feature gives me a complete summary, scoring my performance and offering personalized recommendations on how to improve. The AI coach walks me through the key moments, highlighting what went well and where I could have handled things differently. And when it comes to product or treatment recommendations, the AI always refers back to the exact input and source documents we provide, ensuring everything stays accurate and compliant.
There's a key moment worth looking at more closely. Shall we dive in? Early in the conversation, you did a good job of building rapport by acknowledging Dr. Harbour's busy schedule.
I guess you must have a pretty hard time right now. I saw the clinic looks pretty crowded.
However, as the conversation progressed, some of your remarks could have been phrased more carefully. It's important to avoid assumptions or comments that might undermine the other person's values or dedication.
The detailed behavioral feedback looks at two key areas: competence, things like applied knowledge and strategic communication, and warmth, qualities such as active listening, empathy, and confidence. To create a meaningful recommendation, the AI analyzes both my verbal and non-verbal communication, pinpointing exact moments in my video to show what it observed and how I can improve. The AI coach tracks my progress over time, comparing each session with previous one, helping me to see how I've improved and thereby motivating me to keep growing. Across our clients, we see outstanding engagement with industry-leading activation rates and some field reps completing up to 50 coaching sessions in just their first month. By letting your sales reps engage with virtual HCPs, you gain powerful insights into their strengths and development areas. You can track how well they recall key messages, assess their readiness for real-world conversations, and identify exactly what they need to improve. This allows you to target the biggest skill gaps and close them systematically. And when you connect your Retorio data with performance metrics, you can clearly see how behavioral improvements drive business impact. On average, we see a 14% increase in warmth and a 15% increase in competence within just the first 10 coaching sessions, leading to 8% higher CSAT scores and 38% faster ramp-up period.